Hello guys, welcome to my channel. In today's video we want to look at the pathogenesis of diabetes mellitus. To begin with, there are two types of diabetes, that is type 1 and 2. For type 1, it is when there is insufficient secretion of insulin into our blood streams, while for type 2 is when the cells are insensitive to insulin. So in this slide, we're talking about number 1. The causes can be impaired insulin secretion, that's what we are seeing in 1. Then 2, it can be resistance to action of insulin. Then what do those two things lead to? That's what takes us to number 3. There will be decreased glucose utilization in our cells. And number 4, that will lead to increased glucose output, and hence we shall have a condition of hyperglycemia. So when we have persistent hyperglycemia, we shall say someone has diabetes mellitus. So in our second slide, it is trying to tell us some of the features, some of the signs and symptoms you would get in a person having diabetes mellitus. So let's zoom to see clearly. So firstly, there is decreased insulin secretion or increased resistance of cells to insulin. What does that lead to? That will lead to decreased glucose uptake into cells. If there is no glucose entering into our cells, what happens? We shall have a condition of polyphagia, meaning hunger. That just means cells are not getting enough glucose. Yeah, it is there in the saturation, but the cells are insensitive to insulin, or there is decreased insulin secretion. So shall have a sign of polyphagia. Cells will be really hungry, needing the glucose. Secondly, the hyperglycemia, it will lead to glucosuria, meaning we have reached a very high threshold of glucose, which cannot be reabsorbed back in our kidneys, and so we shall have presence of glucose in urine. And what will that lead to? We know that sugars are osmotically active, so they will try to pull some water from our blood streams, and that will lead to polyuria. So we shall get patients passing large volumes of urine, and due to that, patients will be dehydrated, and you shall have another sign of polydipsia. That is when our thirst centers in the hypothalamus are activated, so a person will have that urge of taking water frequently, many times. So you should know the first 3 classical signs in diabetes, especially type 1, that is polyphagia. We have seen how it is coming about, polydipsia and polyuria. Similarly, what happens when there is decreased glucose transport into our cells? There will be increased lipolysis, breakdown of fats, because really we need energy in our body, because glucose is not entering the cells, and that will lead to formation of ketone bodies. And the ketone bodies, we shall have a ketoacidosis in our system, and that will predispose us to have acidosis. So in type 1, there is high chances of a patient having a diabetic ketoacidosis, which is a metabolic emergency. It is actually an emergency. Furthermore, with diabetic ketoacidosis, is that ketones will be used as the alternative fuel for the brain, because there are no glucose entering into our cells. So we shall resort to breakdown of fats, which will produce ketones, which will be our alternative source of fuel. And secondly, um, they can be generated from fat breakdown. We have seen that, to form acetyl-CoA. And in the absence of aerobic metabolism of carbohydrates, we shall have the acetyl-CoA being converted into acetoacetate, hydroxybutyrate, acetone. But important to note is diabetic ketoacidosis is a medical emergency. It can lead to coma and death, and it needs immediate intervention. We need the short-acting insulins like aspart, lispro. And complications, we shall look at this in our next lecture. Thanks for listening. I'm Abdrazak. Don't forget to subscribe.